Welcome back to Nights of the Blind. Okay, so the next time that you're having an eye exam, and if your optometrist went to school in the Northwest, take a look up at her or his wall, and I'm guessing you'll see a diploma from Pacific University. Today's guest on Nights of the Blind is from Pacific University, and I'd like to introduce you to Dr. J.P. Lowry. J.P., welcome to Nights of the Blind.
Good to be here, Doug.
So our show, as you know, focuses a spotlight on those in Oregon that help address preventable blindness and hearing issues. And it's great to have a vision professional with us. Tell us a little bit about, JP, your role at Pacific University and how you help people with vision issues.
Well, yeah, I've been teaching at Pacific for, about 15 years now, and I specialize in pediatrics, so I actually run the pediatrics clinics, and I have a course in pediatrics that I co-teach and also a course in low vision. And that's my primary roles at the College of Optometry.
And Pacific University, maybe not everybody is aware, not only is pretty much the premier, I guess as you told me off or prior to taping, is like the optometry school in the Northwest.
It is.
And it's an excellent institution, I understand.
We'd like to think so. It definitely is well rated among the colleges of optometry, and Pacific always does well in the ratings and among small colleges, private colleges in the U.S. So, yeah, we are the only college of optometry in the Northwest. There's only 2 other colleges of optometry on the West Coast.
Well, those that have avidly watched Nights of the Blind know that we quite often talk about the Lions work, and I want to thank you and Pacific University for your partnership with Lions clubs over the years. And I understand that you personally are connected to the Lions, and I was hoping that you could tell our audience a little bit about the work that you do that supports the Lions Low Vision Clinic.
Sure. Actually, I got involved with Lions when I was in Silverton in private practice back in 1995. I was part of the Silverton Lions Club, and so understand how important it is to be involved in Lions, especially as an eye care provider, because Lions does so many neat things to help those people with vision problems, particularly in the community. Yeah, I became involved in the Oregon Lions statewide low vision clinic back in 1995. Actually, that was before it was a program of the Lions. The director of the School for the Blind called me on a tip from another optometrist who knew I was a young doc looking for some more work, and but had some pediatric specialty. And anyway, so I started working at the School for the Blind, and my first perspective, or at least my thinking going into that, was that I would be evaluating these kids who had severe vision problems, but were otherwise, normal kids with no other significant issues. But the very first day, my perspective changed significantly, because every kid they brought to me for evaluation either was wheelchair bound or nonverbal or both. And I realized that this is a population of kids with a lot of disabilities, and vision is just one of their disabilities. And not all the kids with visual impairment are multiply handicapped, but about 60 to 70% are. And so, that was certainly changed my perspective and how I have operated the clinic. It became necessary to change in terms of the types of evaluations I do and the types of other professionals that I work with.
So if I understand the Lions Low Vision Clinic somewhat correctly, Lions, is part of their mission of being Knights of the Blind and helping people that might be slipping through the cracks of vision care, provide some resources so that you, as an optometrist, can travel around Oregon. And if I understand it correctly, you work with educational service districts that might identify kids in need. So kind of walk us through, what does a low vision clinic day look like for you?
Well, the clinic is actually, each clinic is organized, like you said, by the local ESDs, really, but it's the state of Oregon is broken up into 8 regional programs for the purposes of serving children with special education needs, especially low incidence disabilities like kids with visual impairment. So usually the supervisor of these programs will contact me and say, hey, we have 8 kids or 10 kids or whatever who need to be evaluated, and we'll set up a time, and then I'll basically go to the site, and this is could be anywhere in Oregon. Typically most of the kids I see are either in the Willamette Valley or Portland, because that's where the population is, but 3 or 4 times a year I pack up the car and take it down to Southern Oregon or Eastern Oregon or Central Oregon and see a whole slew of kids out in those regions. But then each day is always a little bit different. You know, like I said, it's a pretty varied population of kids that I see, from kids who are severely multiply handicapped to kids who are otherwise very good academic kids and functioning at a very high level, college-bound kids, but have some significant vision issues to overcome. And so what I do, or what the clinic does, is it provides educationally oriented low vision exams to basically help the teachers and the parents develop and put in place strategies and adaptations for the kids to help them overcome their vision loss.
Okay, so I'm willing to guess that most of our viewers probably are not vision professionals. So when we use the term low vision in layman's terms, oh, and by the way, I'm going to use that term layperson a lot today.
That's okay.
In layperson's terms, what is low vision?
So low vision, and really we should say, I see children with visual impairment. And the definition of visual impairment means these are kids who have permanent vision conditions that can't be corrected by glasses or surgery or medical intervention. And the legal definition is that their vision is 20/70 or worse. Okay. And so so that means that, you know, the kids on the mild range see about 1/5 as well as the average person, but most of them have worse vision than that, and require significant adaptations, obviously, for reading and board work and other academic challenges.
Well, this sounds like very important work from the standpoint that children with special needs, I imagine some kids have such significant special needs that vision may not be the most obvious need that they have. And so I imagine some kids can maybe slip through the cracks, not have those vision needs met, which can have an effect then on their learning and enjoyment of a quality of life.
Absolutely. I see a lot of kids who, and in the initial evaluation sometimes is the teacher, or maybe it's an early intervention specialist, will suspect that their vision isn't as good as it should be, or that's a major part of their disabilities. And then we go into the process of determining is their vision normal or abnormal, and how is that impacting their overall development, and what does that mean for their future in terms of what we need to do for educational services. Okay. So yeah, that's one whole spectrum of kiddos out there.
And since we discussed Low Vision Clinic and your work with the Lion Sight and Hearing Foundation, I also want to mention and acknowledge the fact that for the last couple of years your work has been supported significantly through the Northwest Regional ESD, and so very much appreciative of that support. So in a way, I'm visualizing you, doing almost mission work throughout the state of Oregon, and lots of doctors do mission trips, quite often abroad. And so let's talk a little bit about Pacific University again, and mission work. There's a group called the Amigos. Yep. Tell us a little bit about your involvement with the Amigos. Who are the Amigos? I saw the movie The Three Amigos. I'm guessing this is different. Tell us a little about that.
Yeah, we're the 1,000 Amigos. Yeah, Amigos is our nonprofit, student-led humanitarian eye care organization at Pacific. And what we do is we travel to different countries, mostly Latin America, but lots of other developing nations as well, and provide eye care for people. And our main mission is to provide refractive care. In other words, providing glasses, because that's something that we can do in a fairly short period of time. We can figure out what optical issues they have and provide glasses. In fact, the glasses that we bring are directly from the Lion's Eyeglass Recycling Program here in Oregon. So we want to thank the Lions for around the state for working hard to collect all those glasses.
Wow. So let me stop you there for a moment and clarify for our viewers. So when somebody puts a pair of eyeglasses into one of those cardboard boxes, maybe at a Safeway or at your local bank or anywhere throughout, here in Beaverton or throughout the state, some of these glasses end up going to international countries, going abroad, and you and your students are then giving them to people in need.
We actually measure the patient's eyes, and then we usually bring thousands and thousands of pairs of glasses with us, because in order to find the pair that might match that person's particular eyes, you have to have many, many more than you would need. Just, it can't be a one-for-one thing.
So your glasses may not work ideally for me.
No,
okay.
no. But we want to match it very closely, because, you know, if we don't match it closely, then basically we might be giving the patient a big headache when they walk away, you know, wearing glasses that aren't the right prescription. So we do our best to match it very closely, and we measure their acuity afterwards through the glasses to make sure they actually are seeing well. But yeah, that's a tremendously rewarding experience, and I've had the opportunity to be involved with Amigos throughout my career, and was on the board for many, many years, and still am on the advisory board.
How many trips per academic school year do our Amigos here at Pacific University embark on?
We do 4 to 6 trips a year,
wow.
and each trip we see anywhere from, say, 1,000 to 2,000 patients. So,
and about how many students get to go on each trip?
Usually 10 to 15, depending on the trip.
Are these students that are about ready to complete their studies?
We take students from all levels. Even first-year students can go on trips, although they have to earn their way, and it takes a lot of work to earn your way onto a trip.
Not easy to be an Amigo.
No, no. It's a lot of volunteer time outside their regular studies, and optometry school doesn't afford them a lot of extra time. So I'm amazed at the amount of work that goes into it every year, and what the students are able to do. It's truly phenomenal.
It must be incredibly rewarding also as an instructor and a teacher to see students abroad, they in turn feeling a sense of accomplishment and reward of helping those less fortunate.
Absolutely. You know, having gone through those experiences myself as a student, that was one of the things as I became a professional. I said to myself, I definitely want to encourage others to go through that process, because you definitely get different perspectives on trips like that.
That's great that that our own Pacific University, you know, here in Forest Grove, can have an impact, you know, worldwide, and that again, as Oregonians, the glasses that we donate helps people in other countries. So thank you very much for being a Knight of the Blind in that respect. So let's talk a little bit more stateside and here at home in Oregon. I know that you support and help out the Lions in Oregon with their school-based vision screening. And school-based vision screening is really kind of a hot issue right now. Wasn't there a law that was recently passed in the last legislative session, House Bill 3000? Can you tell us a little bit about that?
Yeah, that's a neat piece of legislation. Actually, it was all the major players looking at children's vision came together and were able to come to a good agreement on this bill. And so what it basically says is that any child entering a public education program, whether it's at the preschool level or, you know, kindergarten level, they're required to have their vision checked, either a vision screening or a comprehensive eye exam. So this is something that we, the Oregon Optometric Physicians Association, had been
OOPA.
OOPA.
I love that acronym.
OOPA had been advocating for many, many years. And so we're pleased to see this actually come to pass. And really, it just makes a heck of a lot of sense. I mean, we have kids who, when they're by the time kids are in 7th grade, if they want to participate in athletics, they have to have a physical. Seems a heck of a lot of sense to make sure that children have functioning eyes before they enter school.
Right, let me stop you there. Because, you know, I'm not a vision professional. I like to boil things down into simple terms. So are you saying, Dr. Lowry, that if kids can see well, they'll have a better chance of learning well?
Yes, I am.
Okay.
In a nutshell.
So you've heard it here, that yes, supported by a professional, a doctor and an academic.
There's no doubt. There's plenty of research to support that.
yet at the same time, kids don't know if they can't see well.
Yep. And that's the thing. Kids, if your eyes have always been a certain way, if everything's been a little blurry, or if
Right.
when you look at print and it kind of swims and doesn't do, it's really hard to see it. Kids don't know that that's not normal, and so they don't necessarily complain about those things.
Right.
So it's up to us to kind of go in and objectively evaluate their vision before they get into academic difficulty.
So in the months that I've had an opportunity to meet people that are Knights of the Blind and learn more about vision health and school-based vision screening, but what I've gathered from myself is that the concept of going into the schools and providing screening for kids isn't just healthcare. It's an educational program.
Absolutely.
Because I've also learned that studies have shown that if children don't read at their proper grade level, by let's say third graders not reading at a third grade level, their chances of being successful academically and being successful in life can actually decline.
Absolutely.
So it's great that we're screening kids and screening them at as early of an age as possible. Can you continue talking a little bit about the importance of that and how House Bill 3000 hopefully will have a positive impact that way?
Yeah, and ideally, a kid is never too young to actually have an eye exam. The ideal time to actually do a good vision screening, or even better, a comprehensive eye exam, is when a child is an infant. As most people don't realize that the visual system actually develops, for the most part, in the first year of life. And the eyes are changing, but what's really happening is the brain is wiring in. And so we're born with millions and millions of neurons, but at first the connections between those neurons, the synapses, are relatively sparse. But over the course of the first years, the baby kind of wakes up and starts looking at the world and taking in more and more information. And as the eyes develop and become sharper optical instruments, that wiring gets set up so that basically the brain then becomes capable of actually seeing at a high level of resolution. So if a baby is born with something like a cataract or a severe optical defect, that child's brain actually will never wire in to see at the high level of resolution. We call that condition amblyopia, and it's the most common condition that we're really concerned about in early childhood. And so if we can actually intervene, we catch those problems early on, we can actually correct the problem, and then the child develops normal vision. And so that would be, as a pediatric optometrist, that would be my goal, is to have every baby get their eye checked thoroughly.
So again, I'm going to stop you right there, because you used a term that ordinarily, my eyes would roll back in my head when I hear amblyopia, but it's more commonly referred to as
lazy eye.
Lazy eye.
Yeah.
And I'm sure probably all of us have heard that term,
Yeah.
and probably all of us also have seen a younger child, hopefully, with an eye patched.
Yep.
And so talk to us a little bit about that treatment.
Yeah. Well, the term lazy eye is really a misnomer, because it's not the eye that's lazy, it's the brain. And it's because, like I said, the brain has failed to kind of wire in because the eye didn't provide a good image during early development. And so we can still treat amblyopia even into adulthood, and we know that now from research. The brain has some plasticity, but the earlier we treat it, the more successful we are. Right. And so that's why when we catch particularly a child who might have one eye that's very farsighted, at age 5 or 6, we catch it in a vision screening. We give them the glasses to correct it, but then we have to patch the good eye for a couple hours a day, just to make that eye work, make the brain basically wire in to use that eye.
So I find that so interesting, and in a way somewhat counterintuitive, that the healthy eye is actually patched.
Yeah.
Usually you think, well, the bandage goes where it hurts.
Yeah.
My older brother, when I was a little kid, had amblyopia, and I never knew what it was. I just remember he wore a patch for a while.
Yeah.
And so the brain then was working with the optic nerve of the lazy eye, kind of like a muscle is worked out a little bit, I guess.
Well, it's just making the brain use that eye, and by doing that, then literally those synapses get developed to their potential.
Okay, and so again, if detected early enough, that eye, in essence, can really be saved and restored to 20/20 vision.
Absolutely.
Yeah, but the key is catching it early.
Catching it early.
Friends of mine did not have it caught early and really are legally blind in the eye that had amblyopia. So.
Yeah, and it can be severe. We've had some of the kids that I see in the low vision clinic are actually visually impaired and need special services in school simply because their amblyopia wasn't caught early enough. We had a little girl a couple of years ago who came from, I think she came from Indonesia, and she had congenital cataracts, which causes a severe amblyopia. But she got here, had cataract surgery, and now her eyes are optically perfect.
Wow. At
age 10 or 11. But when I saw her in the low vision clinic it was about 2 years later, her vision was still only about 2,800, which is very, very, very poor, because it was really just too late in the game to correct that. She needed to have those cataracts removed when she was a baby.
Okay. So again, pertaining to House Bill 3000, and if I understand it right, sometimes I don't, there's a law now that requires families of children to ensure that their children have had either an eye examination or a certified vision screening by the time they enter first grade or by the time they're 7 years old.
Basically when they enter any public education program.
Okay. And not all schools right now have it in the school districts don't all have it funding to do it. When we were kids, the school nurse conducted vision screenings. And I do understand that some school districts still have funding for that. Some don't. That's where the Lions enter into the picture. And doing everything they can to generate the resources to acquire new technology. Maybe we can talk a little bit about these new photo screeners that enhance the school-based vision screening process so that families can meet the condition of this law, but most importantly so the kids can be identified that need full-on eye exams and corrective lenses.
So I've been involved in kind of helping the Lions develop their vision screening for a long time, and as back as 1998 we developed a pretty good protocol for Lions to do standard acuity testing, with the letter chart and tests for depth perception and near vision, and that's a good screening protocol for school-age kids. But it's very time intensive, and it also requires a lot of subjective responses from the kid, and so it's hard to get preschoolers, and it's certainly even hard to get kindergarten and first graders to give us great results in that kind of testing environment, particularly when we have lay screeners who are volunteering all over the state to do this.
I've seen these screenings, and I've seen that little first grader that's so bashful that who knows, she might be able to see it perfectly, but she's not saying anything to anybody.
She doesn't want to guess. I think I know what it is, but I'm not going to let you know.
So I've seen the volunteer screener have to guess whether or not, such subjectivity to that type of a screening.
So I was pretty excited when Lions decided to invest in the photo screeners, because this technology basically kind of leaps beyond the subjective part and tells us exactly what's going on with the kid's eyes.
Right, and what we happen to have here, this is one of the photo screening devices. You want to kind of show that to the to the audience there, and we don't need to get too much into it. But this is a really it's complex technology, but very simple to use.
It is really easy to use. Basically, just point it at the child's eyes, and the little lights come on, and they look at it, and in 5 seconds it reads their eyes. And what it tells us is actually the power of the child's eyes. In other words, so optically, are their eyes okay? Should they be able to see okay or not? And that's really what we really want to know. It also evaluates eye alignment. So if a child has an eye turn, it'll pick up on that.
That's great.
And so, it's not perfect. Doesn't, no screening instrument is perfect. But I feel that it's certainly as good as what we can do with our lay screeners and the standard screening. Particularly, it's really nice that we can now test preschoolers and test children earlier, because that would be my goal as a pediatric optometrist, to see if we can.
So my understanding is that with this type of technology and Lions Club volunteers and really any adult volunteers that pass a background check, more and more kids in Oregon will have their vision screened at an early age. We'll catch more kids with amblyopia, which is fantastic. We'll also catch more kids that should be going to the eye doctor to get an exam and then get glasses so that they can see the world around them better, learn better, and be productive members of our community. So it's great that we have this. It's a great means to an end.
Yeah.
Of helping kids. So I also want to talk or hear from you in terms of, we've talked a little bit about children's vision, and I'd love to hear a little bit about adult vision issues. I'm a big proponent for adults at a certain age, getting annual eye exams and identifying needs that that we might have at an early stage. Can you talk a little bit about some of the health issues, be it diabetic retinopathy? In fact, why don't we start with that? Can you tell what is diabetic retinopathy? I hear a lot about it.
Well, diabetes, as you well know, is really, we have an epidemic in our society with diabetes, and so when diabetes affects the eye, it affects the blood vessels in the eye, and the blood vessels become leaky, and when they leak, they undermine the health of the retina. And the important thing to keep in mind is not only does that cause vision loss, but when we look into a diabetic's eyes, what we see going on in the blood vessels in the eyes is the same thing that's happening in the rest of the organs of the body for that patient. And so we're really assessing kind of how out of control or how controlled is this diabetes for this patient, and helping that patient then kind of get on the right track. But any diabetic should certainly have their eyes examined yearly, if not more often, depending on what's going on and what the recommendations are from their primary care doc. So yeah, bottom line is for adults, we recommend that adults have eye exams yearly after the age of 40, and that's just because there's a lot of things that could go wrong. We start to break down when we get over 40. I'm fully aware of that myself. My eyes are okay, but other parts of me are falling apart. But bottom line, there's a lot of sneaker conditions like glaucoma that you have no idea that your vision is going south, and if you catch these things early, they can be treated quite successfully.
Right,
so,
great. And the reality is, I wish we had more time to talk more about macular degeneration and glaucoma and cataracts, and unfortunately we don't, but we might have you back for another episode, so we can talk about some of those issues. But be it diabetic retinopathy or glaucoma, cataracts, macular degeneration, if you know of somebody that has a vision issue like one of these, but they don't have health insurance, they don't have the ability to see an eye doctor, we have a number that we're going to put up on the screen and an email address. You can contact the Oregon Lions Sight and Hearing Foundation and seek help for these issues. Let Lions be the knights of the blind and help you. So again, Dr. Lowry, thank you very much.
Hey,
thanks for
glad
being
to be
here.
here.
Thanks for being a Knight of the Blind.
All righty.
Appreciate it.
All right.